We start to see people with developmental disabilities not primarily as having special needs, but really rather as having ordinary needs, or as we often say, as having universal aspirations. It starts to push us to think much more carefully about how we're supporting them to be part of the everyday experiences that really do contribute to a great quality of life, to their thriving. And if we take that really seriously, I think that kind of perspective challenges us to think about, be much more intentional about seeking out the place and the prominence of faith in the lives of the people that we support, to find meaningful ways of supporting people with developmental disabilities in their faith communities, if that's an aspect of life that matters most to them. And so I want to put an even finer point on that statement. It turns out that the presence of a disability label is not at all a reliable predictor of people's faith or the importance of their faith. There's nothing in any diagnostic criteria, nothing in any definitional label that suggests that people with developmental disabilities have a limited capacity for spiritual expression or any kind of diminished interest in being part of a faith community. It's exactly the opposite. And I want to illustrate that in a way that I think only researchers probably think is effective by showing you a graph. But about every 4 years, the National Organization on Disability out of Washington, D.C. surveys a nationally representative sample of Americans with and without disabilities about a whole variety of aspects of life, things like employment, housing, recreation, transportation, and even religious involvement. And in one of those recurring studies, they asked people about the importance of their faith. And the findings are really quite striking because virtually an identical number of people with and without disabilities consider their faith to be somewhat or very important in their lives. 87% for people with disabilities, 84% for people without disabilities. You don't have to be a statistician to know there's no difference to be found there. And while the height of those bars may vary from one state or county or community to the next, we know that those are tightly yoked. Disability is not a reliable predictor of the importance of people's faith. But disability labels do have predictive power in other areas. And it's clear from a number of studies we've been involved with, as well as others, that having a developmental disability does impact the opportunities and the supports that people have to express and to explore and to share their spirituality, either individually or within a community of faith. Because in a more recent iteration of that very same study I mentioned, about 57% of people with disabilities people without disabilities said they attended church or worship or synagogue or some place of worship at least once a month. Not a deep marker probably of engagement, and certainly not a marker of belonging in any way, but it is an indicator of participation nonetheless. And what they found is that only 43% of people with significant disabilities reported that same level of involvement. We talk about that 15 percentage point difference as that participation gap. And that gap starts to even widen when we talk about adults with moderate to severe disabilities who are served in agencies and other state-funded programs, almost to nearly 20%. I'm layering here now data from another source called the National Core Indicators Project. It compiles sample data from agencies in more than 20 states. And as I do, you start to notice a second gap as well. You see a gap between the value people place on faith in their lives and a gap between that and the opportunities they have to express it within a congregational community. And in my view, at least, these are exactly the sorts of gaps that we are charged with bridging. The gaps between people's aspirations and their outcomes and their experiences. And these are gaps that often require us to have new ways of thinking, new ways of doing, both among service providers as well as among faith communities to really address this well. So how do we explain those gaps? What's standing in the way of the active participation for those who see this as at the heart of their own thriving, at the heart of their own flourishing? Well, the data don't let us attribute it to the lack of importance of faith. That's already taken off the table for us. So what is standing in the way of participation? Well, you all are key leaders, maybe even key instigators in your own communities. And so I challenge you as I talk this afternoon to begin thinking about this from either an agency angle or from a congregational perspective, and to think about how the policies and the practices that permeate your organizations or your congregations are working well to support this kind of participation, or how are they inadvertently standing in the way. So now, before coming back to our roles as professionals and providers in supporting this dimension of life, I do want to spend just a little more time addressing why faith might matter so much in the lives of people with disabilities and their families. And to do this well, and because it is a conference on theology, I thought I should probably go back to some sacred texts in some way, right? That would be an obligation. So I've done that. I went to our sacred texts, which I put up on the screen, in my field at least. Yeah, all right, that's a bad joke. And so it raises the question, what would you learn about the place and prominence of faith in the lives of people with developmental disabilities and their families if all you had to do was to look at the professional journals and the books that we draw upon? What might you know about supporting well this aspect of people's lives? And if you've done that kind of looking around, you know the answer is very, very little. It's so rarely part of our conversations in professional circles about what it means to support people well. And so it's not surprising that so many direct support staff, so many professionals struggle to discover and address what really brings people life in this particular area. On the faith community side, the congregation side, we actually know that those sacred texts actually say quite a lot about why this matters. And in conversations about importance of welcoming and weaving people with disabilities into the life of a faith community, they're on the rise. We have gatherings like this that have brought more than 200 people together, a whole host of new books, one-day conferences, all sorts of things that are emphasizing this from the congregation side. And in fact, there are actually a large number of faith groups that have passed really compelling position statements and resolutions articulating a really strong call for why congregations ought to be places of welcome and hospitality and participation and belonging for people with disabilities, just like they should be for everyone else. You'll hear more about the theological underpinnings, I think, of those statements throughout the week, but I wanted to just emphasize how much attention we give to crafting positions on this topic. In fact, some people collect baseball cards, some people collect muscle cars. I collect position statements, which of course makes me very popular. But I'm letting them float up here on the screen. There are actually more than 100, and if you're interested in reading about these or learning more, we've put all of these on our website, faithanddisability.org. And I share this because there's a really clear, compelling call on religious communities to welcome people with disabilities into community life. It's a different call that's being issued than one that's coming from the community. It doesn't appeal to legislative and policy mandates. Those aren't likely to produce the same kind of traction as it does in our workplaces and our schools, but they appeal to scriptural foundations and religious traditions and congregational missions. Those become the catalyst for faith communities to undertake this work. So congregation members, faith community leaders who are here, we can't let position statements be our stopping point in this. We cannot be content with well-crafted position statements that simply don't permeate our practices. So I challenge you this week, this day, to be thinking about what can we point to that clearly communicates our commitment to ensuring every member of our community receives the invitations and the opportunities and the supports to share their gifts within a welcoming community of faith. For my colleagues on the professional side in the field, my collection of companion statements is a lot smaller. In fact, I only have 2 now in my collection. One comes from the American Association on Intellectual and Developmental Disabilities and the ARC. They crafted a joint position statement in 2010 that asserts spiritual expression as a fundamental right and articulating a really strong rationale for supporting this aspect of people's lives and addressing for why so often it gets overlooked. They note that spirituality, spiritual growth, and religious expression that respect a person's history, tradition, and current preferences are rights that must be honored by service systems and faith communities, as should the choice not to participate. And TASH, an international advocacy organization focused on human rights and the inclusion of people with significant disabilities, they've also written a comparable statement. And here they note that supporting the rights of individuals with disabilities to participate in spiritual expression or organized religion as they so choose, and promoting the provision of any and all supports needed by people with disabilities to so participate. Again, the message is that we ought to be as intentional about supporting spiritual expression as we are about supporting any other aspect of life. You know, of course, the challenge of these kinds of statements has always been moving from position to practice. It almost always is. It's the same challenge that accompanies our efforts in the areas of employment and community living. We've got well-crafted positions. We struggle to make those a reality. So agency leaders and advocates and instigators in the disability field, what can you point to that clearly communicates your commitment to ensuring people with developmental disabilities are supported in all aspects of life, including in their faith? I think at a more local level, there are more and more agencies and service providers in North America who are explicitly including spirituality and religious participation among those consumer rights that they strive to support. And maybe that's true of your organization. It's not a stretch. It shouldn't be really a surprise because we already affirm values related to supporting people's personal aspirations, promoting their self-determination and honoring their choices, encouraging their community inclusion, fostering natural supports, and promoting quality of life. So recognizing and supporting spiritual needs and expressions of people with developmental disabilities, really that's entirely consistent with these kinds of values. And in fact, if we take these values seriously and they truly permeate all that we do in our services, then it would be surprising when we're not supporting people well in this aspect of their lives, rather than the other way around. So if those core values, though, really aren't the catalyst you need, consider also the growing empirical evidence, the research support addressing the contributions that spirituality and religious expression can make to quality of life. There have been hundreds of studies that have looked at the associations between spirituality and faith and community involvement among people who don't have disabilities, but new research is starting to emerge that show those same benefits accrue for people with disabilities as well. No surprise at all. But for example, we also recently completed a study that looked at the health and well-being of about 400 young people with intellectual and developmental disabilities. Our interest was really in understanding those factors that really promote flourishing in young people on that cusp of adulthood. And what we found was that their strength of religious faith was one of the most salient predictors of well-being in multiple areas, including in the areas of social support and relationships. So in other words, what we found is stronger congregational connections and greater prominence of faith were positively correlated with more supportive peer relationships and friendships. And that also extended to families. We recently published a study on promoting quality of life among families who had members with intellectual and developmental disabilities. And here, too, we found that the faith and congregational connections of parents was one of the greatest predictors of family quality of life in our particular study. And so providing culturally competent services probably requires thinking about those things that bring families life, including their faith and their connections to a congregational community. So back to that participation gap. The one I highlighted just a few minutes ago. What is it that's limiting the presence and participation of people with disabilities in our faith communities? My experience is that our first answers to those questions almost always go to what's happening or not happening within the walls of a congregation. We can probably all point to barriers of architecture and attitude and awareness and accessibility that have left people feeling unwelcomed and maybe even wounded. And this week, I'm sure we're going to be diving into how our theologies help or hinder here as well. But consider some of the numbers my colleagues and I have compiled as we've explored these issues. More than half, 52% of all adults with intellectual and developmental disabilities have not attended a religious service or some other spiritual practice even once in the prior month. That number should be staggering if you look at the importance of faith in their lives. More than half of parents have kept their children with disabilities from participating in congregational activities because support wasn't provided. 1 in 3 families have changed their place of worship because their child was not welcomed, and fewer than 1/5 of all congregations are said to support children with developmental disabilities in their religious education programs, or to host support groups for parents, or even to provide respite opportunities. Missed opportunities in all of those numbers, certainly. And it's certainly true that barriers of architecture and access are still prominent in many congregations. Take this congregation here in Germany, which I used to believe was the most inaccessible church in the world. It's literally built into the side of the mountain until folks started sending me other pictures of congregations, one in Italy, and then I think, is this one in Georgia? I'm not sure, right? A monk lives up here, but there is an elevator. Right. So I've always been convinced you can learn a lot about the priorities of an agency by looking at how they invest in bricks and mortar. You see a lot about what they value, their buildings, right? But I think same thing can kind of be said for congregations as well. Our facilities of our faith communities, they say something about our theology, about who we expect to gather and who we have in mind, and whether we define our community far too narrowly. So we can't let those kinds of barriers be realities in our congregations. But the most salient barriers are not usually the absence of ramps or pew cuts or sufficiently wide doors, but rather the hesitation that many people have towards welcoming that stranger in the community, especially when that stranger has a label of a developmental disability. These are barriers of awareness, barriers of attitude. They're the hesitations often of our whole culture, and there's not surprising that they also permeate our congregations. But the most common posture that I encounter when I talk with faith communities is not one of resistance, it's one of reluctance. And as Bill has written before, we hear this posture and that response of, we'd love to do more to welcome people with disabilities well, but we just don't know how. We've never received training for this. We don't have the expertise. And that's a disappointing response because it immediately presumes that what one needs is actually special expertise or some manual to welcome people. We've created this false impression that people need most. What they need most is programs and professionals, much more than relationships and ordinary gestures of worship. And that's at the root of that sense of, I don't know how to do this. But I would argue that a very fair treatment of that participation gap requires us to acknowledge that there are also some real barriers to participation that exist on the other side of the congregation door. We spend far less time thinking about the things that keep people with intellectual and developmental disabilities from ever getting to the door of a faith community in the first place. And if we're honest, our service system has not done a good job of supporting the full participation of people in this area. If we're blunt, they've done a dismal job in this area. Right? There are more and more agencies, though, that are really trying to think about how to do this well, but they too struggle with that question of, we're not experts. We would love to support people in this area of life, but we really don't know how. And so because of that reluctance, it almost always leads to omission. Anytime we're uncertain, it leads right to omission. And that omission takes a variety of forms. Things like, well, we don't know how to address it. I feel uncomfortable addressing this. I've never really thought about addressing this as a service provider. I don't have time to do it. It's not my responsibility. I'm not allowed to do it. Someone else must be taking care of it. That's not really our role. Or the worst of all, it's not relevant to this segment of our community. And, you know, this is a struggle we have when we try to support anything that is so important to people, whether that issue is sexuality or politics or relationships. Replace it with any of those things and you see the same struggle. But these are the places that we are called to as service providers to support well. Those personal decisions, those things that matter most is where we're supposed to support the best. And I really do think that's what distinguishes the most compelling service systems from those that aren't, is that they're willing to tackle these things and work through the tough issues that come up when it comes to supporting people and helping their flourishing in this particular area. So what would it look like for service systems to acknowledge and honor and support the faith and flourishing among individuals whom they support? How might our faith communities become places of welcome and hospitality to a segment of their community that so often is on the peripheries and the margins? I know that's going to be the conversations of this day and this week, but I want to get that conversation primed by just sharing a few possibilities and really leave it to you to think about what it might look like for your agency or your organization or your congregation to put these into practice. And the first is a simple one. You might simply take time to reflect on your existing policies and practice as they relate to the spiritual and religious needs of people who you serve. To borrow a few helpful questions, just be thinking about this. Well, what are we doing right now really well in the area of these services and supports? What might we be doing better? What could we be doing entirely differently than we're doing now? And what makes sense as the very first best next step to promote flourishing in this particular area? I put on your screen, and they'll be in the handouts, you can download a collection of 16 relevant indicators that could be a catalyst for this kind of reflection on the agency side. So get the input of your leadership team and your advisory board, from direct support professionals, other frontline staff, the people with disabilities that you support, their family members and friends and allies. And remember that different people are going to have different vantage points on these indicators and the extent to which they're being implemented well. You might simply look at these and say, to which of these statements characterize what we do really closely and which don't? To what extent is this not at all or somewhat or very descriptive of what we do? And then that will lead you to steps for improving your services and supports. You might discover you need to refine your policies in this area, or maybe just ensure that your already well-crafted policies are not overlooked or go unheeded. You might generate new ideas for revising those practices, such as how you approach that individualized planning process, how you think about staffing patterns or transportation arrangements to make sure people really do have the supports they need to pursue whatever experiences and relationships are most important to them. You might realize you have some new staff training needs in this area, where you address when and how to support people's needs in this area, when to provide direct support versus to be a connector, or even when and who to turn to when you have questions. You might also discover the value of forming some new partnerships with congregations and faith groups who can be your allies in these efforts. Or maybe you'll decide that you need to invest in building the capacity of people with disabilities who are receiving your services to advocate for their needs in these particular areas. For congregations, this sort of ongoing reflection is just as important, and there are a number of really great tools out there to help guide you in this process. I've put some on your screen, most of which are free and you can just download. They help you attend to the architecture and awareness and attitudinal and programming and other barriers, the relational issues that might impact your welcome. And so often congregations say we want to be welcoming, but we don't know where to begin. These reflection tools help you identify some of those starting points. So second, I would encourage you to do a lot of listening, as Hans mentioned this morning, and that often is accompanied by asking good questions. Supporting faith and flourishing really is first and foremost about asking those good questions. And I think when we as agencies strive to understand the beliefs and the relationships that people draw upon for strength, when we understand their sense of calling and their purpose in this world, the gifts and the talents that they possess and they want to share, the things that bring them joy or create flow, the ways they view and relate to one another, those can all help us design services and supports that really incorporate those values and really promote that kind of flourishing. And they also push us to see people in quite different ways when we ask those questions. For faith communities too, when you understand what really makes someone feel welcomed and that they belong in your community, when you understand the gifts that they bring to your community and the gifts that others really need to receive that they happen to have, and when you start to strive to find out what it would really look like to make Sunday or Wednesday or Friday, whenever you gather for worship, the best day of the week for a person and their family, you also realize that there's really no one-size-fits-all approach to hospitality. But you also realize that you probably know everything you need to know about welcoming someone well. There are a number of great assessments and person-centered planning approaches in our field of developmental disabilities out there. Few of them make more than a passing reference to someone's spiritual and religious aspirations. But there are some guidance we can draw upon from other fields like health and human services. Acronyms like HOPE and FICA and SPIRIT provide these mnemonic devices that help you facilitate discussions in these areas. You might draw upon these to craft your own questions that you weave into your person-centered planning processes. You might, for example, you might consider questions that address someone's congregational history, their current levels of involvement, their desired involvement, their anticipated support needs. And I put some examples of those kinds of questions on your screen. And again, you can download these from the website, from the Summer Institute website as well. But they really help you think about what it would look like, discover what it would look like to support someone well in this dimension of their life. It gets hard to do this well. It requires your creativity and commitment when someone has complex support needs or limited communication. But that really shouldn't cause us to balk at the need for doing that well. If you ask those good questions, what might you discover? You'll discover for some people this isn't an area of their life that they want your support in. They don't have an interest in this. That wasn't 100% of people who thought this was an important part of their life. And so that teaches us to be careful about proselytizing or pushing that on the people that we support. But for many, it will be, they'll want support to explore this aspect of their life, perhaps for the first time or perhaps in new ways. They may need help connecting to a congregation in their community. They perhaps may need help maintaining that involvement if they're already part of a congregation. And amidst the ebb and flow of support staff, some who will support this, some who won't, we make sure strong supports are in place so someone can keep being involved in their faith community. For others, it will be going deeper and becoming really more part of all that happens in the life of that community. And for others, it will be changing that level of involvement or maybe to a different congregation altogether. We don't want to treat any of these as static choices we never revisit or that we never really seriously consider again. It's an ongoing process of assessment. On the congregational side, similar questions can be drawn upon to understand just how to make whatever day you worship the best day of the week for a child and their family, or to meet real needs those other 6 days of the week after the benediction. And again, on your screen are just some ideas for conversation starters that might help you discern from a family member or an individual what really would it look like to welcome them well throughout all that you offer in your congregation. And third, I think I would encourage you to really help congregations to think beyond Sunday morning or Friday night, whenever you worship and fellowship. Think beyond that one day, those 3 hours, as the most promising place for getting involved in the lives of your members and neighbors with disabilities. We invest so much on what happens for 3 or 4 hours, and we forget the other 6 days of the week. And there are great, intriguing ways to help support people around issues like employment and community living and relationships that extend from Monday through Saturday. And I want to illustrate that just really briefly, knowing that there's going to be more in-depth discussions about all of these throughout the rest of the week. One would be the Putting Faith to Work initiative is an example of what it might look like for a congregation to do this. There are now more than 40 congregations in 4 states that have started to invest in helping people with disabilities from their faith community make the pathway to the workplace. A small group of members from a congregation walks alongside a person, listens to them, learns about their gifts, their sense of vocation. They network within and beyond the walls of their congregation to find employers who need exactly those gifts. And then they connect with agencies and providers to provide the supports someone might need on the job once that connection has been made. And so really these are congregations that are realizing we have all the assets we need to help a person make the pathway to work. If you think about a congregation, they are filled with employers and employees. It's one of the most diverse network of employers in any community. How do most people get their jobs? Through people they know. And which group do you think ought to be primed to see people in terms of their gifts and talents? It ought to be congregations. You put those together and you see some really interesting opportunities here. And then there's life in the community. Our faith communities can really play a great role in spurring new and innovative housing options. Some of you are familiar with the Friendship House out in Western Theological Seminary in Holland, or at Duke in North Carolina, and hopefully soon some other places as well. These are residential contexts in which young people with and without developmental disabilities live in community. They put seminarians in relationship with people with developmental disabilities in their family, and it also gives people, it helps address a real housing need in local communities. The main storyline often is how this addresses the housing needs, but I think the real storyline may be in those seminarians who have the opportunity to get to know and live life together with a segment of their community they might not otherwise have met. And how might their congregations be different because of that in the future? How might their leadership they provide in those future churches and synagogues and mosques be different because of their experiences? And what opportunities would there be here in Atlanta to kind of pursue those sorts of opportunities at Candler, at Columbia, at others? If you come to the Summer Institute next year in Holland, Michigan, you'll have a chance to visit one of the Friendship Houses and see more about what that looks like. And then third, perhaps the easiest thing we can do is simply to be much more intentional about fostering friendships. People need relationships more than programs. You all know that. We all know that. They need to be someone's friend far more than they need to be someone's client. They need to be needed more than they need to be served. And they need to be known for their gifts rather than their labels. And this is a simple place that service providers and congregations can work in tandem to make this a reality. It isn't that people with intellectual disabilities and autism lack relationships. The opposite is actually usually the case. But those relationships almost always fall into 2 of these circles that I'm putting on your screen. The inner circle of family members and the outer circle of paid staff, both of which are absolutely important. But it's those inner circles of close friendships and acquaintances that are so often empty in the lives of the people we support. And here's where faith communities can really hold great promise as a context in which people with disabilities might develop enduring friendships amidst often that transience of paid staff. A place where through shared activities, over time, around a common commitment, and with thoughtful support, friendships have a pretty good chance of being forged. In fact, our analyses of data from 20 states involving almost 12,000 adults with developmental disabilities suggest that people with disabilities who are involved in their faith community end up having more friends and caring relationships beyond family and support staff than people who don't have that kind of involvement. So here's a great opportunity, faith communities. It should be a place that is your place of strength, fostering relationships, and so here's an opportunity for you as well. So I can tell my time is running a little bit short, so I think I'll just bring my comments here to a close and end right where I began, which was the idea that the most compelling systems of support are driven by a deep commitment to helping people with disabilities and their families to flourish, to thrive in ways that really contribute to a good life, to an enviable life. And so as you think about supporting people with developmental disabilities well, think carefully about the place and the prominence of faith and congregational connections, and be intentional about asking the right questions so that you really can support well what matters most in the lives of people. So let me thank you for your important investment in helping people with disabilities throughout this area to flourish in all aspects of life, not only in their workplaces and in their communities, but also in their relationships and in their faith. And thank you also for the generous invitation to join you.